Hi, everyone. Thank you all so much for joining us today for our Navigating MIPS Performance Year 2019 webinar, hosted, of course, by us here at Healthmonix. My name is Usman. I'm an account executive here at Healthmonix. I work with a number of our specialty practices, but here at Healthmonix, we do support any organization that needs to report MIPS, from solo providers to psychologists to health systems and hospitals. So before I jump into any sort of presentation here, I do want you all to know that available throughout today's webinar. There are two sections in the webinar widget. The first is a section to go ahead and submit questions to us. At the end of our presentation today, we'll go ahead and answer a select few questions, but we will be following up with everyone who did ask a question after today's webinar. So just know that while we do have an hour allotted for today, if we don't have a ton of questions at the end, we'll go ahead and wrap up early. But again, of course, still get back to everybody in a timely manner. But also, if you wanted to follow along with me for each slide, we have handouts available as well. So just go ahead and open that handout section and download today's webinar. Also, I just wanted all of you to know to say thanks for taking time out of your busy days to, learn more about MIPS with us. We are offering a discount code on our MIPS registry, MIPS Pro. So you can use the exclusive discount of Healthmonix Webinar 19 to receive per provider discount off of your MIPS Pro licenses. And without further ado, I'm going to go ahead and jump into our presentation today. So just some background on our company, Healthmonix. We're really dedicated to using technology to bridge the gap between quality improvement activities and different initiatives to not only increase quality outcomes but also improve different financial and operational activities in healthcare. Some of our main goals here are to just optimize revenue cycle, reduce your administrative overhead, and really close gaps in care. And today we're going to specifically focus on your 2019 MIPS reporting and your roadmap to success. So just to start off the gate, we're going to take steps to make all of you MIPS experts. From there, we'll determine how you're able to report and ultimately submit your MIPS reporting to CMS. And finally, we'll review how our registry MIPS Pro is going to get you there. So I think the first question on everybody's minds when it comes to MIPS reporting is, am I eligible? So the eligible clinician types have increased from the first 2 years of the program. So physicians, physician assistants, nurse practitioners, and other providers who were reporting in 2017 and 2018 are still eligible to report MIPS, but now included in year 3 of the program in 2019 reporting are a number of new specialists. Included in them are physical therapists, occupational therapists, and clinical psychologists. There are still a few ways individual might be exempt from MIPS reporting despite being an eligible clinician type. So if you are newly enrolled in Medicare, fall below the low volume threshold, or participate in an advanced alternative payment model as an individual, you would be exempt from MIPS reporting. However, for the low volume threshold, while you are exempt for falling below any of those three criteria there, starting with 2019 reporting in year 3 of the program, you do have the option to opt into MIPS reporting. If you end up exceeding any one of these criterias here, you might be asking yourself, why would I decide to opt into MIPS reporting if CMS is giving me a free pass? And really, one of the biggest reasons why is by opting into MIPS, you are eligible for incentives or positive payment adjustments from CMS. Additionally, these MIPS reporting scores and CMS's performance feedback reports are available for the public to view. So if you just wanted to share with potential patients your MIPS reporting scores, it's definitely a great idea to opt into MIPS reporting. We also do strongly encourage practices of 2 providers or more to report MIPS as a group for really 2 big reasons. Number one, it drastically increases your potential return on investment. So if you look closely at this table here, we provided a breakdown of a practice that just reported for their 2 eligible providers versus that same group reporting for their whole 10. And you'll see here that while some of the initial costs of reporting were quite significantly higher when they decided to report MIPS as a group, their estimated overall return on investment had a difference of $50,000 about. So there's a huge financial incentive to report MIPS as a group. And if that's not enough of a reason for you, another big advantage of group reporting is to reduce your overall administrative burden. Just as an example, all clinicians in the same 10 will receive the same score based on performance. So you don't need to repeat the same steps for each individual provider if you're reporting MIPS as a group. So it's definitely a great idea to increase your incentives from CMS and make reporting even more seamless and efficient for yourself. And I've already alluded so far that there are payment adjustments associated with MIPS reporting. Here you can see a breakdown of what the incentives and penalties have been so far with MIPS reporting and what they're projecting to be in the future. So for 2019 MIPS reporting, there are 2 big numbers to really keep in mind. By failing to report MIPS, you would receive an automatic 7% penalty. However, by reporting MIPS, CMS is conservatively estimating incentives of about 4.69%. And to really get that positive payment adjustment, you'll need to pay attention to these 2019 transition year pacing options here. So the minimum for MIPS reporting has doubled from 15 points to now 30 points. So you do need to score at least 30 points this year for MIPS, or else you would be facing that 7% penalty. Just getting 30 points is enough, the bare minimum to avoid that penalty, and any score above that would result in some incentives. But again, if you really wanted to maximize your incentive and your final score from CMS, you'll really want to get above that 75-point threshold, which CMS calls their uh, high performers essentially. Now, jumping into each MIPS performance category, they're still the same 4 that you reported on for 2018 MIPS reporting, with quality, promoting interoperability, improvement activities, and cost. To begin, we're going to go ahead and jump into quality reporting requirements because that still does account for most of your final MIPS score. So just some basics for quality reporting this year. You do need to select 6 quality measures, and of those 6, 1 must be an outcome measure. However, if you're, for whatever reason, unable to select an outcome measure, a high priority measure can be selected in its place. And for those at least 6 quality measures, you would need to report on 60% of all patients seen in 2019. What that means is you need to be reporting on 60% of all patients. That means all payers, not just Medicare, seen in the entire calendar year. That's January 1st through December 31st. Also, just know that when you're determining how to submit your MIPS reporting to CMS, if you are a practice with more than 15 providers, more than 15 clinicians, you are no longer able to report via claims. So I know that's a lot of work, and I know how people are submitting is going to change, pretty drastically, especially if you have been going through claims so far. So now we'll just like to take a moment to jump into how our registry MIPS Pro is going to help you report. MIPS Pro supports all CQMs, all ECQMs, and some QCDR measures. So we have more than 200 quality measures for you to choose from. And our team is also really able to help work with you to, at the very least get you to 6, but help you identify ones that are going to get you the highest overall score from CMS. Additionally, there are a number of ways MIPS Pro is able to accept your data to help you with your MIPS reporting. So you can upload custom spreadsheets right into our system, but you can also upload industry standard files that you can export from your EHR. Additionally, we do have a number of direct integrations for certain EHR systems to make that reporting process even more seamless. But once you begin sending us data in MIPS Pro, we process that information in real time to provide performance feedback and scores for each of your selected measures. So what you're looking at here is the decile score for each quality measure selected in this MIPS Pro account, which essentially is taking that measure performance rate and weighting it against CMS's benchmarks. So this is a great way to evaluate how you're doing in each measure, how CMS is really going to evaluate your performance, and also allows you to identify some of the measures that are now beginning to get topped out and more difficult to really get a high score in. Additionally, for each measure here, we do provide the performance rate as well, with the opportunity to really drill down into your performance. So you'll note here that each one of these numbers are hyperlinked. So for example, if you're looking at measure number 48 and you notice you performing really poorly in that measure when you thought you would have been doing a lot better, you can select those 64 patients that did not meet measure number 48 and identify what was missing in their documentation or what was missing when the patient was seen, so you can make an adjustment to your reporting here and get the higher score for that quality measure. In addition to providing this level of data for your group reporting, MIPS Pro does also provide the same information by provider. So whether you have a group of 2 providers, 10 providers, or 200, we're able to run individual reports for each provider so you can really assess those who are doing well, but more importantly, assess providers who might need a little more help with their MIPS reporting to ensure that patients are getting the quality of care that's needed, but also at the same time, MIPS is being appropriately documented so your practice is able to successfully report to CMS. And these individual reports can be shared directly with providers or printed to PDFs so you can address them with your practice. And like I said, MIPS Pro supports more than 200 quality measures, but our system, regardless of how many measures you select, is able to automatically identify your top 6 highest scoring measures. So even if you were to report 10 measures or all 200 plus, our system is automatically identifying which 6 quality measures got you the highest score and therefore would get you the highest incentive from CMS. So I think this is one of really the coolest things that MIPS Pro has to offer, and quite frankly, takes a lot of the worrying out of MIPS in terms of selecting your quality measures. And of course, if you wanted to go back and drill down into your patient visits, this is what it would look like here. And you're able to identify each, or rather review each patient one by one to see how they're doing in each quality measure, and really, look to make changes here to help you increase your score. Also at Healthmonix, improvement is really important to us, and performance improvement, increasing quality of care. And that's why we've created this Catalyst program for improving MIPS. So a number of quality measures in MIPS Pro has these different Catalyst programs for you to follow in different cases to really help you increase your performance for that quality measure, increase the quality of your patient care as well. And so that's just a few ways MIPS Pro is able to help you with your quality reporting and increasing your overall score to CMS. I'm now going to go ahead and take a step back and go back into providing details for each of the MIPS performance categories. So the second highest score is promoting interoperability, which often gets referred to as PI. This accounts for 25% of your final score and has just a 90-day minimum reporting period. What's new in this category from last year is you must be on a 2015 certified EHR technology to even be able to report this category of MIPS. What's also new for this year is it's predominantly performance-based scoring. So for each PI measure, you would need to go ahead and document how many patients are actually meeting the requirements for this measure, and then you are then would receive a score based on that performance. And all of this can be tracked and submitted through our registry, MIPS Pro. Also, just keep in mind for promoting interoperability, there are a number of automatic exemptions based on different specialties, different clinician types, and different organizations, at which point PI would be reweighted from 25% down to 0%, and those 25 percentage points would just go towards the quality category. So here you can see all groups that are exempt from promoting interoperability. A few that really stand out are hospital-based clinicians, non-patient facing clinicians, and ambulatory surgical center-based clinicians. Clinical psychologists are also exempt from PI, and again, those 25 points do get reweighted to the quality category. But also just keep in mind that if you are reporting MIPS as a group and that group does contain providers that are eligible for this category, then some of these groups or clinician types may still be eligible. Next up, we have improvement activities. Like promoting interoperability, there is a 90-day minimum reporting period, but you do have more than 100 improvement activities available for you to select on your own. 40 points are required in this category through the selection of high-weighted improvement activities and medium-weighted improvement activities. However, if you are rural, HPSA, or a non-patient facing clinician, or a small practice, you do just need 20 points in this category to get full credit for improvement activities. And just like all other categories of MIPS, you can go ahead and select your improvement activities in MIPS Pro, attest to them directly in our system, and we'll go ahead and submit it to CMS on your behalf. And finally, we have the cost category, which is now worth 15% of your final MIPS score, up from 10% last year. Unlike quality, PI, and improvement activities, cost is automatically calculated from your administrative claims data, meaning CMS will be automatically calculating cost for you, and you don't need to submit anything for it like you do for the other three categories of MIPS. The performance period for cost is the entire calendar year. So CMS will be reviewing data from January 1st, 2019 through December 1st, or I'm sorry, December 31st, 2019 for this category. There are two measures for cost on Medicare spending for Part A and Part B beneficiaries. So CMS will be evaluating the total per capita cost there, as well as the Medicare spending per beneficiary. CMS has also introduced 8 episode-based cost measures for those who may qualify, just because a lot of those tend to be pretty specialized. And just as a reminder, we here at Healthmonix are here to help you with your MIPS reporting through our registry MIPS Pro, through our real-time scores and updates. Again, we support all MIPS categories and validate your data and guarantee submission to CMS. Additionally, if you need any help utilizing our tool, while we pride ourselves on having it be a really simple system, we have an entire support team here that is 100% stateside. So they are able to guide you from the very beginning of your MIPS reporting all the way through submission. We are open year round from the very beginning of the year up until CMS's deadline. And for those of you who are concerned about how MIPS Pro would be able to get your data and provide you your MIPS score, there are a number of ways we can integrate with your data, receive your data to help you out. So if any of you are interested in more information about MIPS Pro, feel free to ask us any questions at the contact information below. Also, just as a reminder to everybody and just as a way for us to say thank you for joining us for our webinar today, if you do want to go ahead and get started with MIPS Pro, please be sure to use the discount code Healthmonix Webinar 19. And with the time remaining left today, we are going to go ahead and in a moment begin answering some questions out loud that we think are applicable to most groups reporting MIPS. So I'm going to take a brief moment here just to review some of those questions before we resume and read them out loud. Thank you. All right, we're going to go ahead now and begin answering some of these questions out loud, starting with this first one. So this is a federal program. So plus and minus has to be equal in regards to dollar amount. So if you are a huge group and have an over 85 MIPS score, it does not mean you will gain all that money back from CMS. So yes, so any sort of incentive percentage that you see is based off of an estimate by CMS, what they're really projecting the dollar amounts people earn back will be. Um, this gentleman is correct. MIPS is a budget neutral program though, so any whatever money is paid back in incentives is based off of how many groups ended up paying a penalty. For 2019 reporting, though, we do expect that incentive from CMS to still be quite significant because they are making it more and more difficult for groups to avoid the penalty. So it's definitely still worth investing in your MIPS reporting because that payout ultimately will start to get more and more significant. Moving on to the next question, I selected to report as a group using CMS Web Interface, but when I checked the QPP site for EC eligibility, no one was qualified. Does this mean no payment for us? So in this situation, I would recommend you evaluate your eligibility as a group to see if the group overall is qualifying for MIPS reporting. I would also just be sure to check to see if those individuals are able to opt into MIPS and therefore be eligible for any sort of payment, any sort of incentive if you would like. We are more than happy to help you review your group's eligibility. So feel free to reach out to us directly at the contact information on the screen, and we'll be happy to work with you. All right, the next question is one we hear quite often. I was told that we only had to report on Medicare visits. However, this webinar indicated we must submit for all visits across all payers. So that is correct. For MIPS reporting, and this has been true since the program started in 2017, you do have to report on all patients across all payers. So it is not just a Medicare exclusive program. You do have to report on patients even if they're Medicaid, private insurance, or paying out of pocket. CMS is looking for you to report on 60% of all patients across all payers still. So keep that in mind as you begin to determine how you're going to be reporting MIPS, how you're compiling this data, and how you're ultimately going to submit to CMS to ensure that you are going to be still able to avoid that 7% penalty. And our next question here, does MIPS Pro track cost requirement measures so we can see where we're at? So yes, so MIPS Pro does have a cost tracking tool available called Cost Pro. This will be going live pretty soon. And what this cost tracking tool is going to be able to do is pull in your claims data directly from CMS and help you determine which patients are being attributed to your providers, to your practice, and ultimately what your scores are for each cost measure. So if you do want to get ahead of your cost score and not get blindsided by your evaluation from CMS, we definitely encourage you to reach out to us to learn more about MIPS Pro's Cost Pro tool. All right, and we have another question. Are my physical therapists required to report quality if we are a group ACO. So yes, so physical therapists are eligible clinician types now for your reporting. So if you are reporting as a group, you would need to include them in that group reporting, even if those physical therapists might be exempt as individuals. Also, I just want to share, since this individual mentioned their group ACO, in addition to our registry MIPS Pro, in addition to our cost tracking tool Cost Pro, here at Healthmonix, we also do support ACO reporting through our tool ACO Pro. So if anybody would like to learn more about that, again, I highly encourage you to reach out to us directly at the email address or direct line on the screen. All right, we just got another question here, which is a great one. Where do you check your group's eligibility? So on the MIPS Pro website, we actually have a participation lookup tool. So what we can do is share that with you directly at the end of today's webinar. So you can use that tool to look up each provider. A big difference from our MIPS participation lookup tool and CMS's is you're able to copy a list of NPIs and just paste it right into our system instead of looking them up one by one. So we'll be sure to share that link with you so you can check your group's eligibility and share that with anybody else if they request it. All right, so we don't have any other questions that have been submitted. However, since we do have a lot of time left, we are just going to stay on for about another 5 minutes. However, if we don't get any additional questions, we'll go ahead and sign off. So again, if anybody does have questions, feel free to submit them to us while we're still on here at the GoToWebinar widget. But if anything comes up after and you would like more information, please feel free to send us an email or give us a call directly. Thanks. All right, so questions are still coming in, but we just got a number of them that I think would be really valuable to answer out loud, starting with this one. Do you know of any easy way to identify if quality measures include telehealth visits besides going through each individual measure? So there is an easy way to do this in our registry, MIPS Pro. Like I said, we have more than 200 quality measures that we support. Any measure that can be submitted through a registry, we have to offer. But we understand that it can be pretty cumbersome to look up each quality measure one by one. So instead, we have a number of tools to help you filter this list. So what you could do to see if any of them apply to telehealth is simply put in a code that you commonly bill for, like an ICD-10 code or CPT code, anything really indicating a telehealth visit, and filter the list, and that will just bring up any quality measure that contains that code and is therefore telehealth relevant. So you can look up measures, in a large sum directly in our system, MIPS Pro. So that was a really good question right there. Next question, I have WebPT, which for those who don't know is a physical therapy focused EHR system. What is the communication between my EHR, Healthmonix, and CMS? So yes, so Healthmonix and our MIPS Pro registry is partnered with WebPT. So we are automatically receiving their data from any of their users who sign up with our registry, and ultimately, when those practices, when those providers are ready to submit to CMS, they can do so from directly within their MIPS Pro account, and we submit it to CMS automatically on their behalf and validate submission if it's gone through successfully. Next question, our clinic does not have an EMR. Is it still possible for us to get to the 30 points needed to avoid the penalty? So that's a great question, and I'm glad that was brought up. Yes, even if you do not have an EMR, you still can report MIPS. You can still report that avoid that 7% penalty. To do so, what we generally recommend to small practices to get 30 points is to report the quality category and improvement activities through what's called our standard reporting package. For quality, all you would need to do is select 6 measures and report on 1 patient per measure. For improvement activities, you would just need 1 or 2 of them, which you can then attest to in our system. And from there, you'll get just those 30 points. You'll just confirm in MIPS Pro that you are in fact avoiding the penalty, and you can go ahead and submit it to CMS. A lot of people are able to get that done in a single afternoon. So if you're worried about, facing that 7% penalty, feel free to reach out to us, and we'll be happy to show you in more detail how MIPS Pro can help out. And speaking of MIPS Pro, we have another question. How is the cost component derived? So just to reiterate, cost is automatically calculated from administrative claims data. So CMS is looking at your claims for Medicare Part A and Part B beneficiaries and then deriving a cost score based off of how much is being spent on those patients. If you are concerned about your performance in this cost category or would just like for it to be more transparent, we do have our tool Cost Pro, which is able to receive claims data for you and is able to provide performance scores, feedback, and additional analytics so you have an understanding of your performance in this cost category and are able to make changes along the way. And we have one more question here, the CMS web interface fact sheet. It states at least one MIPS eligible clinician So you are saying that since we are a group eligible and able to opt in, we can still report. So yes, so if you are group eligible, you can report MIPS as a group and you'll still be available to earn any sort of incentives from your reporting. So if the group is eligible, you're eligible to report MIPS. CMS will review your MIPS submission and provide any sort of payment adjustment based off of how well you do. I also just want to say one more thing about our tool, MIPS Pro. If you are debating between group reporting and individual reporting, we do have a revenue impact estimator that is able to take in your overall score as well as how much you're billing to Medicare and help you identify, is it more advantageous to submit MIPS as a group or as an individual or both, and allow CMS to decide which one gets you the highest score. So just keep that in mind if you're struggling between group reporting and individual reporting, that MIPS Pro allows you to do both. All right, and since that is our last question, even though we do have some more time today, we do want to give that time back. However, again, if anybody does have additional questions about MIPS reporting requirements or how our tool MIPS Pro can help you succeed with MIPS, please do not hesitate to reach out to us at contact@healthmonix.com or to give us a call at 888-720-4100 extension 3. Also, we really appreciate all of you for taking the time out of your days to learn more about MIPS Pro. So for anybody interested in using our registry, please use the code Healthmonix Webinar 19. We really want to show you our appreciation, and what better way to do that through a discount. All right, I'm going to sign off now, but again, just want to thank all of you, and we look forward to staying in touch. Thank you.